Hey guys, welcome to the ICD-10-PCS Coding Series. If you are new to the channel, subscribe and follow the playlist from the beginning so that you understand every concept thoroughly. This is part 6 of the Inpatient Coding Series, and today we will learn about the administration section value of the ICD-10-PCS. I'm Vinay Kumar. I carry an overall experience of 2 decades in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in gaining knowledge and preparing for medical coding certifications. I am dual certified from both AHIMA and AAPC with extensive knowledge in all the verticals of the RCM. At the end of this learning session, we will have a better understanding of the first character in the administration section of the PCS coding system. Now, as you all know, there are 7 characters in the PCS coding system that are used to build a code based on the procedures performed. Section, body system, root operation, body system or body region, approach, substance, and qualifier. This is for the administration section. And these are the 17 sections in PCS, and today we are talking about the administration section value. And remember, multiple codes can be reported from different sections of the PCS based on the combinations of procedures performed. The administration section includes procedures like transfusions, infusions, and injections. Other similar services such as irrigation and tattooing are also included in this section. So, the primary purpose of the codes from this section is administering drugs and other similar substances, which could be therapeutic or diagnostic in nature. Characters in each section have a specific meaning, and this is the table that shows each character value in the administration section. The first character represents the section itself, second character, body system, third character, root operation, fourth character, body system or region, fifth is approach, sixth character identifies the substance that is administered, and seventh character provides additional information for the qualifier. And as I said, transfusions, infusions, and injections are all coded to this section. The first character value is 3 for the administration section. Now, second character has 3 categories: circulatory, indwelling device, and physiological systems and anatomical regions. For the third character, there are 3 root operations in this section: introduction, irrigation, and transfusion. Any substance that is administered for therapy, prophylaxis, or diagnosis is generally coded to the introduction as the root operation in this section. For example, epidural steroid injection or a local anesthetic injection for pain control. These are all coded to introduction as the root operation. Now, if the substance given is a blood product, then the root operation would be transfusion. And if it is a cleansing substance like peritoneal dialysis, then the procedure is coded to irrigation as the root operation. The fourth character identifies the site where the substance is actually administered. Sites include skin and mucous membrane for intradermal injections, subcutaneous tissue for subcu injections, and muscle for intramuscular injections. Similarly, for arteries and veins, the peripheral artery or vein is used when a substance is introduced locally into an artery or a vein. For example, chemotherapy infusion into a peripheral artery or a vein by percutaneous approach. The central artery or vein is used when the site where the substance is introduced distant from the point of entry. For example, infusion of thrombolytic substance into a central artery or a vein by percutaneous approach. This substance usually has a local effect. Now, a few other sites for the body region in this section also include eye, nose, ear, respiratory tract, peritoneal cavity, epidural space, and so on. So this is for the fourth character. The fifth character, approach for intradermal, subcutaneous, and intramuscular injections is percutaneous. Placement of a catheter for infusion of substance into an internal site in the circulatory system is also percutaneous. For example, if a catheter is placed for infusion of contrast directly into the heart for an angiography, then that procedure would be coded as a percutaneous approach. Almost all procedures from this section are usually coded as percutaneous approach only. Now, for the sixth character specifies the substance that is actually being introduced. Substances are actually divided into broad categories like an anesthetic agent or a contrast material or blood products such as platelets. Okay, now the seventh character is a qualifier and is used to provide further details about the type of substance given to the patient, like whether it's a vaccine or an insulin or a monoclonal antibody, for example. That's for the seventh character. Now, these are a couple of examples from the administration section. The first one is for percutaneous irrigation of knee joint. Now, this procedure is coded to the administration section since this is only an irrigation procedure and not a true surgical procedure. If it is a true surgical procedure, then it would be coded to the medical and surgical section. So the section is administration, physiological systems as body system, irrigation as the root operation, body system or region is joints, approach is percutaneous, substance type is an irrigating substance, and no qualifier. And this is another example of total parenteral nutrition, which is coded to the administration section. Okay, in this case, the substance type is nutritional substance. So the key points to remember are the primary purpose of the codes from this section is administering drugs and other similar substances. Percutaneous approach is used for intradermal, subcutaneous, intramuscular, intravenous, and intraarterial administration of substances. And the sixth character identifies the type of substance administered. These are the key points that you will need to remember from this section. I have provided the references and the resources here and also in the description of the video. You can use it for coding purposes. Thank you so much, guys. We'll talk about the measurement and monitoring section in the next video, but I'm going to do the root operations as well pretty soon so that we get into the actual medical and surgical section coding root operations. Thank you.